Hi, welcome to the Lindner Chiropractic and Nutrition Center. I'm Dr. Stephen Lindner. I'm the chiropractor, and I also have my Master's of Science in Applied Clinical Nutrition. After you visited our website, which is www.nutritionchirodoc.com, and you print up the forms, you'll be coming into our office. After you're greeted, we'll have you come on back for your chiropractic examination. When you come on in, this is what the table will look like. Some people come into us for wellness, and some come into us because they have some sort of musculoskeletal problem and they have trouble mobilizing. So this table actually makes it easier for two people. One, the person who can't move around as much, the table starts in this vertical position, and then you'll see when I lower it, it goes down all the way to a horizontal position very, very slowly while you're on it. After it goes all the way down, I can then, after the treatment, after the adjustment, can then raise up the table so you don't have to strain your back, and it comes all the way up. The second thing that's really nice about this table is that if you're pregnant, it's very important to be adjusted, and this part of the table, as you can see, drops all the way in so that the belly, there's no pressure up against the belly. I'll show it again. You can see that this section drops all the way down and locks in that position. So while a woman's body is changing through those 9 months of pregnancy, the adjustments helps keep her body in change, in that state of adjustment. So after we do your spinal examination, you'll get your adjustment, and when you're finished, at that point, I like to scan people's feet to look at the structure and foundation of the feet. So if you look over here, this is our foot scanner. It only takes about 10 to 15 seconds to scan both feet. And the information that I get from that is then brought up on the computer, and you can see that this structure here in thermographic readings is a normal foot. We could see the hot spots. There are 3 hot spots. And then here on this, we could see that there are some slight changes to the structure. So when I'm adjusting a patient and I'm adjusting their feet and their hips and their spine, after 30 days or so, if there's no change to that, we then send this to the foot levelers, and they will make a spinal pelvic stabilizer, what other people may refer to as orthotics. Since you're on your feet and that is the first floor to your body, it has a domino effect to the knees, the hips, the spine, and everything thereof. So one of the things that we look for as chiropractors is, my main interest is to look at your spinal structure. The better your structure, the better you're going to function. And one of the things that we talk about is something called a subluxation. If your spine is nice and aligned, you'll see that the spinal energy goes down from your brain, down your spinal cord, and out through these nerves. If there's a subluxation, a slight deviation, a misalignment, you'll see that there's nerve irritation that takes place. And as a chiropractor, my job is to try and reduce that subluxation, reduce that misalignment, and open up those channels so that the brain can better communicate with the rest of your body. So your spine and your body is like an antenna. Like those old TVs used to have these antennas, and if you adjusted the antenna just right, you get better reception. And I want to make sure that your body is receiving messages and putting out messages to the world with clarity. Now there's also some question as to the different techniques that we use. I like to use my hands whenever possible for the adjustments, but there are some people that are hesitant or have some inhibition about receiving adjustments that way, or they don't like the clicking sound that's heard with it. So I just want to show you a few other methods that I have to make those adjustments. It takes out some of that anxiety that many people have. So if you come over here, this is a little tool station that I have that gives me a few options. One of the methods that a lot of chiropractors use is a technique called Activator. And you'll see that this adjusting instrument has a few different settings on it. And if I put it on a light setting, you'll see the impulse. You'll see how my finger moves. Doesn't hurt, it just sends that impulse through. So I could use this on your spine to make adjustments as well. So that's one technique. Another is an instrument called an arthostim. This does not send in electrical impulses to the body like electric stim may. This is an adjusting instrument that simply can move the bones in any direction. Also, a lot of people like this, a lot of children like it, a lot of people that may have osteoporosis that are afraid to receive a hands-on adjustment, people that have different forms of arthritis. This works very, very well to correct subluxations and restore better motion to the body. So there isn't just one technique that we use. We use a multitude of techniques depending on what that individual needs. We adjust wrists, elbows, shoulders, hips, knees, ankles, as well as the spine. It's a full body, holistic perspective. Okay? And so we're going to put a pause to this brief video, and we're going to go to part 2, which shows a little bit more visually what a subluxation is and how it affects your overall state of wellness.